Hello all, today we are going to discuss about esophageal spasm. I am Mrs. Golden, working as tutor in M College of Nursing. Objectives: at the end of the class, we will be able to discuss about what is esophageal spasm, what are the types in esophageal spasm, etiology and risk factors, clinical manifestations, diagnostic measures, and management and prevention of esophageal spasm. Definition: esophageal spasm is an involuntary and painful contraction which occurs in the esophagus, that is, a muscular tube connecting between the mouth and the stomach. So, esophageal spasms, it feels like a sudden, bad chest pain which can last from a few minutes to hours. If the esophageal spasm occurs, it affects the ability of a person to eat or drink, and treatments are available for this type of disorder. Types of esophageal spasm. So there are two types of esophageal spasm. One is the nutcracker or jackhammer esophageal spasm. The other is the diffuse or the distal esophageal spasm. So in this nutcracker or jackhammer esophageal spasm, in this type of esophagus, the muscle contractions are very strong and forceful. It is very intensively painful, but it does not cause regurgitation. But the pain may feel like squeezing in the chest. Whereas in diffuse or distal esophageal spasm, in this type of esophageal spasm, it is less painful, but it can cause regurgitation to the person. So overall, in the esophageal spasm, esophageal spasm is a sudden chest pain, like painful contraction, which occurs with difficulty in swallowing, and food getting stuck sensation can be felt. Some object which can be stuck feeling in the throat. Regurgitation may occur. So overall, in the diagnosis, you can see like esophageal manometry, X-rays and upper endoscopy can be ruled out this esophageal spasm. So managing the condition of GERD, avoid the food which cause the esophageal spasm, that is which triggers the esophageal spasm. Always choose warm or cool food. So overall, in treatment, medicines and surgery can also be the treatment for the esophageal spasm. So what are the causes for esophageal spasm? Gastroesophageal reflux disease, that is the GERD, anxiety, depression, surgery of the esophagus, radiation of chest, neck or head, drinks including the cold wine, certain foods like too hot or too cold can cause esophageal spasm. Risk factors: age between 60 to 80, high blood pressure, drinks with very hot or very cold, gastroesophageal reflux disease, sex: women are more likely to have esophageal spasms than men. Clinical manifestations: chest pain, difficulty in swallowing of solids and liquids, heartburn, feeling like something stuck in throat or chest are the clinical manifestations for esophageal spasm. So diagnostic measures. So coming on to diagnostic measures, medical history and physical examination of a patient, endoscopy, that is during endoscopy, a thin flexible tube called an endoscope is inserted into the throat, which allows the view inside of the esophagus. Barium swallow. This X-ray imaging test requires the patient to drink a contrast liquid to offer a better view of the esophagus. Esophageal manometry. If no structural abnormality is detected, then this test can be performed to measure the pressure waves inside the esophagus. So in overall, diffuse esophageal spasm. So it is nothing but a painful contraction which occurs in the esophagus. So coming on to the clinical manifestations, what and all we can see are episodic retrosternal chest pain, intermittent dysphagia, that is the difficulty in swallowing, regurgitation can occur. So when we are seeing the diagnostic measures, esophageal manometry and barium swallow. So in barium swallow, The X-ray imaging, we can see like corkscrew or rosary beads like appearance can be seen in the X-ray imaging in barium swallow, upper GI endoscopy, ECG, and esophageal pressure topography can be done. So under treatment, to reduce the acid reflux, proton pump inhibitors are used. To reduce the severity of the spasm, calcium channel blockers and nitrates can be used. In surgical, pneumatic dilation can be done or myotomy can be done. Medical management, proton pump inhibitors such as esomeprazole, omeprazole, pantoprazole and rabeprazole or H2 blockers like nizatidine and cimetidine are recommended for the GERD. Antidepressants like serotonin or epinephrine reuptake inhibitors are preferred for anxiety or depression, and calcium channel blockers or nitrates are used to decrease the pressure and to relieve pain. Botulinum toxin can bind the receptors in the nerve ending, so this treatment can be used to decrease the release of acetylcholine. Coming on to surgical management, peroral endoscopic myotomy. That is, in this surgical procedure, a surgeon may insert an endoscope through patient's mouth and then cuts the muscle at the bottom of his or her esophagus to weaken the contractions. So this procedure is called as peroral endoscopic myotomy, POEM. Next procedure is the Heller myotomy. In this, it is another minimally invasive surgical procedure. In this procedure, the surgeon may cut the muscles of your lower end of the esophagus to weaken your spasm. So this is the picture of the myotomy. Nursing management, educate the patient about the esophageal spasm. Instruct the patient to lose his or her weight if she is overweight or obese. Instruct the patient to avoid wearing constrictive clothes. Encourage the patient to eat smaller meals more frequently. And during surgery, care is taken to avoid trauma to the common carotid artery and the internal jugular veins. The surgical insertion may be observed for evidence of leakage from esophagus and any risk of developing fistula. Foods and fluids which are held with until the X-ray study shows no leakage at the surgical site. Diet begins with liquids and it is progressed as tolerated. Coming on to prevention, drink water with few drops of peppermint oil. It may relieve your minor symptoms. Eat several small meals each day instead of large servings. Increase the fiber intake. Reduce or eliminate the alcohol consumption. Lose weight if your body mass index is high. And avoid wearing constrictive clothing. Complications: wound infection, atelectasis, pneumonia are the complications of esophageal spasm. Thank you all.